Although the 8 presidential candidates in the 2011 elections have made pledges to address healthcare, they are still short on specifics on how they will deliver these plans as promised during their 5-year tenure in office. And at the moment, Uganda's health situation could do with some improvement. The country's life expectancy is among the worst in the world, at 48 years for men and 51 for women, below the average for sub-Saharan Africa at 52. In terms of healthcare performance, Uganda is ranked number 186 out of 191 countries according to the World Health Organization. Infant mortality is high at 97 deaths per 1,000 births, and so is maternal mortality. Every day, over 16 women die of pregnancy and childbirth-related complications. While the country has made remarkable progress in disease management and control over the last 10 years, this is still not good enough. Malaria is still the leading killer, claiming over 11,000 lives each year, most of them children and pregnant women. The AIDS epidemic still rages on, with about 1.2 million people living with HIV/AIDS and over 90,000 AIDS-related deaths every year. Besides, there are 124 new infections each year and still going up, but only half of those who urgently need ARVs are getting treatment. But experts say that perhaps the single most important challenge to healthcare in Uganda is the shortage of health workers, and any political party that wants to take over power in 2011 must clearly demonstrate how it's going to address the human resource issue. In Uganda, the doctor-to-patient ratio stands at 1 to 15,000, way below the recommended WHO ratio of 1 doctor to 10,000 people for Africa. The very low physician-to-population ratio is not so much from the small number of medical graduates as to the immigration of the graduates to other countries. According to the government policy framework, the target is to have the ratio of doctors to patients drop to 1 to 12,000 by 2015. While increasing the number of health workers alone may not solve the vast unmet health needs of the country, the belief is that no health system can function well without an adequate number of doctors to participate in clinical and public health work management, education and policy making. Across the board, all the political parties have promised to increase salaries of health workers, improve their working conditions and generally keep them motivated and working.
The NRM government is realistic. Because if you are raising only 100 shillings, what is 15% of 100 shillings? It is simply 15 shillings. So you are not talking anything. So the opposition can talk about the increasing by 15% because they do not know what it means to run the government.
Which brings us to another critical issue, health financing. Most parties are promising to increase health sector spending, either by increasing the budget share to health from 10% to about 15%, or by cutting down on the waste in the sector.
You don't actually need to increase any budget. Just look at when we had Chogam here. Morago Hospital was allocated 9 billion for major repair. And then a bulk of that money was given to Kano Mugenyi. So the lifts you went to repair, the following 2 weeks were non-functional. In fact, we have a lot of money that can provide Ugandans with all the services. The problem is that all that money ends up in private pockets.
Unimpressive as their manifestos might be, analysts say none of the parties have set out a clear strategy of achieving better healthcare for the country.
I think that while some of the parties have appreciated the problems in the sector, I think that some are over-ambitious. Other parties like PPP, for example, have very weak proposals for the health system. Looking at their manifesto, they say the sector is underfunded, it is weakly mismanaged, but they have no concrete proposals on what they are going to do.
We just talk about a principle that we are going to focus on this, we are going to put more focus on this, we are going to put more focus on that. The operationalization part of it will come later when we are in power, right? That is how our manifesto is spelled out.
The National Health Insurance Scheme is another critical issue that would see Ugandans benefit from prepaid medical care, but it has not been clearly addressed in the political parties' plans. The NRM, like in the previous manifesto in 2006, has pledged to kick off the health insurance scheme, but after all the failed starts, critics doubt if it can be achieved over the next 5 years. But experts agree that while there's no magic bullet that can provide the answer to all of Uganda's health woes, presidential candidates need to clearly show that whatever resources are available are well utilized to produce the greatest returns on health. Anna Tkunda, NTV.